Hello, I'm Dr. Frances Pitsillis. These days, cancer is often not a death sentence. Many of the cancers that could not be survived 30 years ago are now curable. Radiotherapy is often part of the cure and can be combined with surgery and possibly chemotherapy. Sometimes radiotherapy can be prescribed to cure the problem or to extend life or to treat the pain. Whatever your situation, your cancer specialist is the expert on this treatment and how it may affect you. Radiation therapy is usually in the form of a very small wavelength of light called gamma radiation. It's at the very small end of the light spectrum, and if you wanted to put this wavelength in perspective, it may help to know that the next biggest wavelength is X-rays, then ultraviolet light, then visible light, then infrared, then radar, then microwaves, then FM radio, and then TV, and then shortwave, and then AM at the other end, right? Radiotherapy is designed to damage cancer cells and kills them. It does this by damaging the DNA, the proteins in the nucleus, and in the cell membranes, and by creating a lot of free radicals, damaging molecules that steal electrons and damage tissues. The problem, however, is that normal cells are often affected as well. And so the skin and nearby organs receive bystander damage. The ideal situation would be to find a way to optimize the cancer-killing effect of radiotherapy, but also protect the normal cells. Early reactions to radiotherapy include redness and swelling of the skin along with tenderness and any other local effects depending on where the radiotherapy is given. For example, if it's the chest or the breast, there could be an effect on the heart or blood vessels, which may thin, and the arm on that side may swell up and cause stiffness or shoulder pain. Any damage to the nerves, bone, or cartilage in this area could cause pain as well. If it involves the area of the mouth, the esophagus or food pipe or bowel, there would be an effect because these cells are rapidly dividing and so they're damaged by the radiation. The result is that these areas become inflamed and sore, so the patient would find it difficult to eat and digest. The long-term effects of radiation include thinning or fibrosis, which is hardening up of the tissue, and loss of stretchiness. This may affect the skin, the membrane around the heart, and the lungs, depending on where the radiotherapy has been performed. And it may even, if it's the chest, affect the coronary arteries and the lungs. Radiotherapy can cause nutritional deficiency. Obviously, it's quite damaging, so antioxidant vitamins and minerals may be affected, but we know that it has been recorded that vitamin B12 and calcium deficiency have been recorded. It's important to remember that if you've been prescribed radiotherapy, it's for your overall benefit and in many cases life-saving or life-extending. When we view it overall, the benefits generally outweigh the risks. However, it would be ideal if we could reduce the damage and optimize the effect of the radiotherapy on the cancer. The notion of a patient taking antioxidants during radiotherapy is worrisome to cancer specialists because they don't know for sure whether it might help the cancer cells survive. So when you're discussing this dilemma with your specialists, they'll usually suggest that you take these things after and before, but not during your radiotherapy. The ideal situation would be to have something that works well to assist the radiotherapy to kill the cancer cells. Genistein is found in soy foods and increases the sensitivity or vulnerability of cancer cells while protecting normal cells. So soy foods, soy milk, not a problem. Aspirin and Quercetin, which is found in vegetables and apples and red onions, also does this job, and it also helps to reduce inflamed mouth and gut membranes. Statin drugs reduce inflammation of the bowel and fibrosis of the lungs. ACE inhibitor drugs that are used for blood pressure protect the kidneys, the optic nerve and the lungs. Curcumin, which is found in turmeric, sensitizes cancer cells to radiation and chemotherapy and protects the liver, kidney, the mouth and the heart from toxic effects. Vitamin E succinate enhances damage to cancer cells while protecting normal cells, and that can be used as a cream on the skin as well. Luteolin is a substance found in vegetables and leaves and also helps. Oxygen can even act as a sensitizer because cancer cells like a low oxygen environment. So if you can exercise as much as you can tolerate while you're having radiotherapy, that is a very good thing. Now there have been some herbs researched and these include withania. The other names are winter cherry and ashwagandha, which help protect the heart from doxorubicin chemotherapy, but also sensitizes cancer cells to radiotherapy. Korean ginseng protects the normal cells from radiotherapy and chemotherapy. However, to be completely safe with all of the things I've mentioned, you must discuss them with your cancer specialist. And your cancer specialist will usually suggest that you take these things after the radiotherapy is finished. So what can you do to help support yourself through a course of radiotherapy? Get support from family and friends. Maintain a healthy diet with adequate protein and a lot of different vegetables and include soy foods. Get as much exercise as you can tolerate. This can help fatigue in up to 80% of people. Keep optimal control of any other health conditions that you have, like hypertension, diabetes or heart disease. Correct any nutritional deficiency like vitamin B12. Continue your normal medications unless your specialist advises you differently. Don't smoke. It puts extra burden on your natural antioxidants in your body because smoking drains your antioxidants. Foods like liver, kidney and heart can help DNA repair and can be useful when the radiation's finished. After the radiation, take your antioxidants. Restart fish oil and a general multivitamin when the treatment's finished. And quite importantly, an amino acid called glutamine, along with some digestive enzymes, can help gut repair and digestion when your radiotherapy has finished. So as you can see, this is very good advice for you. Re-listen to this video carefully. Take notes because you can do much better than the average person that goes through radiotherapy.